Hi, this is Dr. Bill Morgan with Chambers Medical Group, and I thought today that we could go over what happens when a patient is in a motor vehicle accident and they are coming to see us for an assessment. We're going to begin with an examination of the cervical spine and what injuries can occur during an automobile accident. And then we're going to also go into what a lumbar spine, low back spine type of injury examination looks like. When patients have injuries in an automobile accident, it's usually a whiplash type of injury. And during those injuries, two things can occur. One is injury to the skeletal muscle. Those muscles, as the motion goes forward and backwards, get torn in these areas and also in the areas here. So what we do in the examination is to palpate those areas. And I can feel if they're tight, because muscles start to heal with tightness and they become rigid. I can feel if they're tender. The patient will tell me if they're tender as I'm starting to palpate those muscles in the neck. And then it comes down to the muscles that are in the top of the shoulders called the trapezius muscles. And these muscles get very, very tight, particularly when attempting to put your arms overhead and things of that nature. And so we come from there and we feel that, and then we come down to what's called the thoracic spine, the middle of the back. So the cervical spine is the neck, the thoracic spine is the middle, and the lumbar spine is the very bottom, pretty much down to the buttocks. And when we look at that, we feel what's called the rhomboid muscles, which are the muscles that keep your scapula centralized in the back. We feel the right side of the rhomboids muscles, see if they're tight, see if they're tender, see what the mobility is, and also the lumborum quadratus muscle bellies of the lumbar spine. And then throughout the whole examination, we're looking at the spinous processes of the spine itself to be sure that there's not one area of the spine that I touch that causes specific pain, which may suggest something we call a compression fracture or something of that nature.